Bionox is motivating wellness. Welcome to Motivating Wellness with Dr. J. I'm your host, Jay Wilkins, and as we do with each episode, is we team up with people that are motivating wellness in their own right. So we've had practitioners on here, we've had research scientists, we had a personal trainer, and today is our first time to actually have a massage therapist, as well as a business owner, a wellness center owner. So we'd like to introduce Janine Willey. And just a little bit about her. The name of her wellness center is TerraMar. So we're going to find out what that means here in a little bit. But her philosophy for health and well-being is to take the whole person into consideration for each and every session. Give clients tools that they need to succeed in pain-free life, individual goals, health history, and get feedback from them. Now, the different things that she does is Swedish relaxation techniques, deep tissue massage, trigger point therapy, neuromuscular therapy, myofascial release, lymphatic drainage, as well as reflexology. And she is a certified WATSU. Did I say that right? WATSU?
You did, yep.
All right, practitioner and certified neuromuscular therapist. So Janine Willey. Did I say it wrong in the beginning?
No, you had it.
Okay, good. Because I always in my mind it was Janine Wiley. And then I had to force myself to say, no, it's Willey, Janine Willey. So very good.
My husband is Billy, so that's how people usually remember.
Okay, good. So Janine, it's really great to have you on the program today. Of course, I have personal understanding of your work because me and my wife have come to you as clients of yours, and you worked on us, did a great job. And it's obvious that you know your stuff, you know your way around muscles. So we want to get started with a few questions. We'd love for you just to tell us a little bit about yourself. Some of the things that were fascinating to me is, besides being a massage therapist, is you have this beautiful wellness center, which you did most of the artwork in, which is amazing. And then also you were a medical illustrator. So I have to believe that helped you in your work as well. So just tell us a little bit about yourself.
Okay, well, I was an illustrator all over the Atlanta, Georgia area for about 25 years, and I worked for most of the major corporations in Atlanta. Maybe not most, a lot of them, we'll say that. And I drew all kinds of things for all kinds of companies. And the last company I was at was the Weather Channel, and NBC bought the Weather Channel, and I needed to move on. So I did. And my dad always wanted me to massage his shoulders and neck. And I used to love to do it as a kid. So I decided that would be the career for me. And I never looked back. It was wonderful.
Very cool. Awesome. So how about with some of the artwork that you do? What what kind of things do you specialize in? You know, I've seen what you've done to walls. I've seen what you've done with pictures. It's really cool.
Yeah. So I've always been an artist. I guess since kindergarten, I decided an artist was what I would be for life. And I pursued that and followed that career up until about 11 years ago, almost 12 years ago, when I decided to change. So I draw, paint, and sculpt pretty much anything I can get my hands on for no other reason now than just personal enjoyment.
Well, they're beautiful things. And what we'll do is we'll get you to maybe take a few pictures and we'll incorporate that into the videos so we can show people what you can do. So very good. So how did you make the decision to open your own wellness center? So you mentioned as a kid, you did well with your hands and working your dad over, but how did that translate into you having your own wellness center?
Well, when I first started massage school, everybody talked about this particular type of massage that's called WATSU, and you're going to be hearing a lot about that.
Cool.
And I needed a warm water therapy pool to be able to do that, and I couldn't find one anywhere. Not one to rent, not one to use, and so I decided I had to build one. And in order to build one, I have to own the land, because it county codes in Carrollton, it needs to be an in-ground pool. It can't be an above-ground pool. So I had to find a place to buy. And if I was going to spend all the time and money to buy a place, I might as well make money with it. So I found a place to have my wellness center. And the sole reason for that is to build a pool. So right now I'm in the middle of designing and planning and all of that to get my pool built. And in the meantime, we have this great wellness center to use and bring the community in for.
What made you want to get into massage therapy? Is there more of the story than what you shared already?
I'm a people pleaser, I guess, and I like to make people better. So I knew from the very beginning that the type of massage that I would do is more of a medical massage. I think that relaxation massage definitely has a place in this world, but that's not really what I focus on. People come to me when they're in pain or have mobility issues or knee surgery, knee replacement, shoulder surgery, that type of thing. And that's really what I specialize in. I kind of hone in on the people that are in pain and help them to not be in pain anymore.
Yeah, that was what impressed me and my wife when we talked about it, is just your knowledge of the muscles, how they move, how they're designed within the legs or within the arms, and how, you know, it's obvious that your knowledge is vast with that, and we appreciate what you do very much. With your wellness center, how many practitioners do you have? What are some of the services that you have under your roof?
So we currently have 8 women. We have 2 counselors, we have a reflexologist, we have a sound bath person, and then we have 3 amazing massage therapists. Well, we have 2 amazing massage therapists and me. We all do kind of a medical take on massage, but we're very, very different than each other. We complement each other's work, but we are not even in the same realm of the way that we deal with people. So we have a lot of clients that see all 3 of us, you know, they rotate between us because they get something very different from each one of us.
Yeah, and that's the good thing. Having a specialty that you offer it's always good to really dive into specific things. Of course, that's what I've done in a broad sense with naturopathic medicine and herbology and that type of thing. But as you know, my real passion or niche now is all about nitric oxide nutrition.
Right.
So that's a good thing, you know, when you can kind of dive into your specialty.
Absolutely. And I do lymphatic drainage, and neither Sarah nor Tanya do that. But Sarah does medical cupping, and she also does ashiatsu, which is massaging people with her feet, basically. So she can get very deep, but also very gentle and really get into those tissues. And then Tanya does a lot of pregnancy massage. She does very targeted work as well. It's just, we're just different.
Yeah, cool. Very cool. TerraMar, where did you come up with this fascinating name? What does it mean?
Well, I have to give all of the credit to Sarah Littlejohn, who is my business partner. Sarah came up with the word. Terra means land, and mar means sea or ocean. And everything in TerraMar is either water-based or land-based. So everything that we have just fits right into that name. And it was a perfect fit. When she came up with it, I was like, yes, that's it. That's the name.
Cool.
So that's what we have.
Nice. Makes me think about our bodies. We're 70% ocean and 30% land, if you will, right?
Yeah.
What is your process for a new client? So they come into your office and it's their first time. It's your first time meeting them. Right. How do you take them through their journey at your office?
It all depends on why they came in. That's the first thing that we have to discover. But we have so many pieces of equipment at TerraMar and so many ways to deal with stress, pain management, you name it, we're there for it. So that's the first thing we try to find out is, why are you here? Once we know that, we can recommend the very best way for them to accommodate whatever it is they have going on. So we have 2 clinical counselors. So if they need somebody to walk them through a certain phase of life, or if they're really just dealing with something very heavy at the time, we have Amy Gilbert and Jay Marks, and they're always there to talk to people. And then if it is, say, fibromyalgia or knee replacement, I mean, it really just depends. We will put them in the oxygen therapy. We have a hyperbaric chamber, and we'll suggest that. Otherwise, the full spectrum infrared sauna. We have a float tank, which is also called a sensory deprivation tank. We call it a float tank because most people that get in it want a little bit of sound, like a meditation or music, and light. And so if they choose to go the sensory deprivation route, that's always available to them. If it is a muscular issue, we have 3 massage therapists to help them with that. If it's somebody that has never in their life tried yoga or meditation, we have classes for that, but our classes are very different than what you would encounter in a gym or even a yoga studio, because we are really inclusive. It doesn't matter where you are in life or if you've ever had yoga before, ever tried yoga before. We take everybody through a very, very personal journey where they don't feel like they're standing out in the gym, where they don't feel uncomfortable trying to move their body, maybe for the first time. We can start them out in a chair and be very gentle and very mindful about it. And there's, I don't know if you've ever tried yoga at a studio before, but it can be very intimidating, especially when the yoga master or the yoga yogini is tying herself or himself up in pretzels. And you feel like, oh, wow, I can't even touch my toes. I really can't do that. That's fine. Those are our people. Those are the people that we serve, people that really don't have another place to go where they would feel really comfortable.
What about, you mentioned infrared and hyperbaric chamber. So what would be 2 different, what kind of people would benefit from that? Let's put it that way.
So infrared, we have a lot of people with arthritis, whether it's rheumatoid arthritis or osteoarthritis, and heat really does well with arthritis. It helps to warm up their joints and they can move much more comfortably. And so our infrared sauna, first of all, it's a full spectrum sauna. Some saunas are far infrared, and far infrared is probably the most beneficial light ray because it penetrates the deepest. That's for getting the other 2 frequencies of light. So we have mid and near range infrared in our sauna, which means the near just penetrates the skin surface. The mid range gets into the into the muscles and tendons. And then the far infrared goes all the way into the organs. And the really cool thing is you can make the sauna as hot as you want it or as cool as you want it. So we have people that would benefit from the light energy that is infrared, but can't bear to be hot like that. And so they can get into the sauna and keep the temperature around, say, 90 degrees, which is a little bit cooler than your skin's temperature, and still get all the benefit, but without that oppressive heat that some saunas are. Did that answer your question?
It did. And we experienced it. Of course, me and my wife like it as hot as it can get. I do.
Yes.
In particular, and sweat it out. And so we used your facility and you used your sauna, and we, it's great for detox, right? And sweating it out. So,
Right.
and that you, like you mentioned, the light therapies and what it does. So, and then the oxygen hyperbaric chamber, when would that be appropriate for somebody?
So we have people that have fibromyalgia and they think that it really helps them to deliver oxygen to every cell in their body, helps their body work a little bit more efficiently, which helps them with their symptoms of fibromyalgia. But also people will, or doctors, I should say, not just people, will send people post-op and pre-op for a dental procedure or for knee replacement or shoulder replacement. So they come before their surgery to get their body in the most optimal position for surgery. And then they come after surgery to help heal and recover much quicker. A lot of athletes will use a hyperbaric chamber. They'll have it delivered to their hotel room after a game to help recover from whatever happened in the game. And so that's another way that our chamber is used, is post-game recovery. And we even had one lady who used to come all the time. She changed her flights, but she was a stewardess. And so she would have a lot of jet lag. And when she had long international flights, she would come to recover from her jet lag. That's great. That's another really wonderful use for it.
Good deal. Swedish relaxation techniques. Tell us a little bit about that specific type of a technique and how it's beneficial.
Okay, so it's very light and very gentle and a very soothing stroke. So all 3 of the massage therapists at TerraMar, all 3 of us can do Swedish, but we don't do it that often because people are usually coming to us in acute pain, and just the gentle technique isn't really what they're looking for. If we do get someone who's coming for relaxation to relax their mind and their nervous system and their body, then Swedish is what we would do. And it's just very long, relaxing strokes and a very gentle way of treating the body.
Yeah, good. So how about lymphatic massage? As you mentioned, you're the one that really specializes in that. What is that like, and why would you suggest someone to? I see the benefit of that. In fact, that's something I will refer out to in particular, because I know people's lymphatic systems are just completely jammed up.
Right.
And with what I do with detox programs and that type of thing, it's a great way to, as they detox, facilitate their exit strategy, so that we can move the toxins out. So to explain a little bit about what a lymphatic drainage massage is like and why you say it's beneficial.
Okay, so here's the thing about the lymphatic system. Every medical doctor on the planet should know as much as they possibly can about the lymph system. And I have yet to meet a doctor who even understands the importance of it. I'm not going to say they don't know what it is, although I know that there are some that don't know what it is because I've met them personally. But your lymph system is the very first thing in your whole body to encounter whatever you are doing. It's whether you eat something, whether you touch something, whether you breathe something. It's all about your skin. It's all about your fluids and how they react to that. So your lymph is your blood and your blood is your lymph. And it can't be more important than that. And so I meet people every day whose legs are swollen, whose arms are swollen, who feel like their fingers are little sausages. And if they try to bend them, it's painful and tight to even bend their fingers. That's just wrong. And they go to the medical community, and the first thing a doctor will do is prescribe a water pill. And what that does to the human body is it makes your lymph fluid stickier, gooier. It dehydrates your lymph fluid so that it's not able to move well through your body. So it should be the last thing they prescribe, unless you're bedridden and you can't move your body or, for whatever other reason. But it shouldn't be the first thing that they go to. What needs to happen is somebody, and in this case, let's just say me, will get their fluids moving through a very, very gentle, rhythmic touch. It really isn't much deeper than a feather or a nickel laying on your body. You can't go any deeper than that, because right under the skin, if I could peel up the skin, right under the skin is the channel by which that fluid travels. And if you press into it, then you're not giving that fluid a way to get out. So you've got to just gently stroke, rhythmically pump that fluid to the lymph nodes, which are mainly in joints like your armpits, your groin, your neck, behind your ear. You get that fluid there, and then it goes to a holding tank, say holding cavity. And then your body decides how much lymph is needed for each organ to function, how much lymph is needed to be turned back into blood, how much lymph is needed to lubricate every muscle, every ligament, every tendon in your whole body, and how much is excess fluid that your body's just been hanging on to. And that fluid can sit there in those joints around your ankles, around your feet for years. And all the garbage that needs to be getting out of your body is just stagnating in those puddles and those pools. And nothing good comes of that. So we want to get that fluid off of you. And if I need to help somebody's body to do it for themselves, especially if they've been taking water pills for a long period of time, then that's what we do. We get that fluid moving, and then the client will just excrete it through urine. They'll pee it out 3 to 5 days, and their pee might be darker, smellier, or thicker than what they're used to, depending on how long all of that fluid's just been stagnating and just sitting there in those joints.
So obviously, along with your technique, you no doubt recommend proper amounts of water intake to help them move the sewer lines properly.
Right, and compression garments if they're not already using them.
So tell us a little bit about this, not necessarily just with lymphatic massage work, but just in general. Over the years, you'll build this Rolodex of clients that come to you, and some stand out more than others as far as when they first come to see you, and as time goes on, who they become. through your work. So tell us a few success stories, maybe one or two that just stand out to you since you've been doing that. And how long has it been total for you to do massage therapy?
I've only been doing it for about 11 years.
Only 11 years. Well, that's pretty.
I plan on doing it for the rest of my life. So
love it. Great. Well, all your clients will be happy to hear that.
Every single day, every day, I witness a miracle. I'm like at the front row seat to a miracle. If somebody comes in and they cannot move their arm at all, and that happens with a frozen shoulder, and they come in and they're just kind of like, that's as far as I can go. And then they leave and they're able to bring their arm all the way around and move it. That to me is a miracle. That is Absolutely. Amazing. And in some cases, they haven't used or moved that arm in years. And they have been told time and time again by orthopedic doctors and doctors in general, well, just get used to it because that's the best you're going to get. And the answer is no. That is not the best you're going to get. Let's figure out what's going on, what's pinning that. And every once in a while, I can't help. And in that case, I send them to a doctor, but with a very specific list of questions to talk to that surgeon about or that doctor about. So, gosh, it's hard. I'm hard pressed to figure an exact one that really stands out, because I've got one, is a very healthy lady. She was in her 30s. She was told that she had lupus. So she was upset and depressed, and she had led a very active life up until the time that she came in my office. And the very first time I touched her, I realized that she was kind of fluffy, very thin body, but kind of swollen. When I touch her, there was a lot of fluid there, and I could tell. So we did lymphatic drainage. She had the expected result of peeing, and I watched her legs go from legs to regular legs. And I told her the second time that she came to me, make another appointment with your rheumatologist. I want you to go back to that doctor and have all the tests again just to see what happened. Because in my mind, I'm thinking she doesn't have lupus. What she has is a compromised lymphatic system, and it's probably hereditary. And she's probably just been hanging on to all of this fluid. Once we get the fluid off of her, her symptoms should abate and she should feel so much better. So she did. She went back to her rheumatologist, and then she called me on the phone in the car on the way back. And she said, "You're not even going to believe this. I don't have lupus anymore. You cured me." And I'm like, "I didn't cure you at all. You never had it." So, and I hear and see those stories all the time. Or doctors that tell my clients that they have carpal tunnel and they need surgery because their pinky is numb. Well, that nerve that innervates that finger doesn't go through the tunnel at all. So they definitely don't have carpal tunnel. And I'm not in the business of second guessing doctors. I know there's a lot of absolutely fantastic doctors out there, but I understand that they're under a lot of stress. They have a huge client load, and they need to move people through that office. And sometimes they don't have the liberty to take the time to really get to the bottom of what's happening with each and every client or patient. So I get that. And I'm not trying to, put down the medical profession. They're wonderful, and I'm glad that they're in our world. But sometimes it may not be that. It may be something else.
Yeah, the saying that I use sometimes, and again, it doesn't apply to all practitioners, as some are better than others, but if you have a hammer, everything looks like a nail.
Right.
So sometimes that's the case, is that's their perspective on it more than anything else. It's just their perspective. Mm-hmm. So you're able to give people a different perspective and right. to help them to transform their bodies in a way that helps them to have greater health, more mobility. Yeah. Obviously, with the lady that was diagnosed with lupus, and for you to help mm-hmm. her like that, I know she had to have been absolutely thrilled.
Oh, absolutely, yeah.
Yeah. So there's your rewards, right? It's exciting to be able to help people to get their health back.
Join Dr. J next time with Janine Willey in episode 2.